different universities. And let's go. I am trusting God as always that you all will pass your council exam. You all will pass. So, in this academy, we always acknowledge God. So, we acknowledge God first. We give God Almighty all the praise. Because without God, no one can achieve anything. Now, a student chatted. I said, Sir, Sabrini, please help us explain scholar system. Now, particularly, there is this course in cardiovascular system, which a lot of students bypass, a lot of lecturers bypass, but it is always present in council exam. And what is this aspect? The coronary circulation. The coronary circulation. A lot of students do not read this aspect. Now, firstly, this wonderful student that chatted me from a university said that after the previous lecture on the heart, that it was well simplified, but I should also simplify the blood flow through the heart. Now, that brings us to our discussion today. Now, there is something that students don't read, and that is what? Blood flow to the heart. Now, blood flow through the heart is totally different from what? Blood flow to the heart. Now, we have what we call blood flow through, something passing through, blood flow through the heart is different from blood flow to the heart muscles. Now, I'm going to read so that wonderful students will write. Now, the heart muscles, also known as the myocardium, needs its own supply of oxygen and nutrients to keep contracting. Very important. This blood supply is called coronary circulation. That is what we want to discuss. Coronary circulation. It comes out in exam so much. Are we together? Coronary what? Circulation. What students know is that blood flow from the right atrium to the right whatever, then to the right this one, then to the right that one. Now, but there is this aspect that students don't read in, and it comes out a lot in exam, which is this word coronary circulation. Now, please let's pay rapt attention and let's copy. Please, your reviews means a lot to the academy, like I always say. Your reviews means a whole lot. So pick up your pen and your paper and jot, very important. And after the simplified lecture, you send your reviews. Now, the heart receives oxygenated blood mainly through the coronary arteries, so which arise from the ascending aorta just above the aortic valve. Now, every wonderful student in this academy should pick two things from this introduction. What is the thing you are picking? Number one is that there is something called blood supply to the heart muscles. It is different from blood flow through the heart. Through means passing through a channel, but to means it is going directly into somewhere. So the muscles of the heart, before it will contract, it needs blood. So that blood that is going from the right atrium to the right ventricle to the pulmonary artery, all those ones is important, but those ones are not supplying to the heart muscles. Now, what is supplying to the heart muscle? The element that is supplying to the heart muscle is called what? Coronary arteries. This is the spelling. Coronary what? Arteries. These are the arteries. Remember, arteries carries oxygenated blood. So the coronary arteries are the arteries that supply to what? The coronary arteries are the arteries that supply to the what? The muscles of the heart itself. Are we together? The coronary arteries are the arteries that supply the heart itself. So the heart on its own have muscles. There are muscles in the heart. So the coronary arteries supply these muscles. Are we together? And another point you should know is that this coronary arteries is arising from the ascending aorta. These are council questions. It is ascending, it is arising from the word ascending aorta. Where does this blood supply come from? Now, there are two branches of this coronary artery. Remember, whenever you hear of the word coronary artery, don't forget this. Coronary arteries are arteries that supply the heart muscles, the myocardium of the heart, that enables the oxygen in the myocardium. That is when there are infarction and other ischemia of the heart, all those things. So there are arteries that carries oxygenated blood that supply the muscles itself, not the blood flow through the heart. So the name of that artery is what? Coronary arteries. Are we together? Now, this coronary arteries is divided into two. Number one is the right coronary artery, known as the RCA, and the left coronary artery, known as the LCA. Are we together? The coronary arteries are divided. Remember, there are things you need to know. Remember, you don't cram in this academy, you learn by the grace of God. Number one point is that blood flow through the heart is different from blood flow to the heart muscles. That's number one. Every wonderful student that joined this live session is learning. Number two is that the name of the artery that supply the muscles of the heart is called the coronary arteries. Coronary arteries, they supply the muscles of the heart. And it's because of the muscles of the heart are receiving oxygen. That is what gives it energy, ATP, to contract and relax, because the coronary arteries are supplying it. Are we together? Now, another thing you need to know is that this coronary arteries is coming out from the ascending aorta, not descending aorta. I will show you the picture. It's coming from the word ascending aorta. Another point you need to know is that these coronary arteries are of two types. Number one type is what? The right coronary artery, which is also known in short as the RCA. And the other one is the left coronary artery, known as the LCA. Are we together? Please, this is live session. All the wonderful students that are live, please notify me in the comment section. Very important. I would love to see your names, your universities, your colleges. Very important. That is why we are having a live session. Are we together? So please notify me in the comment section that you are hearing me. Now, they arise from the ascending aorta, which is just above the aortic valve. Now, we are going to quickly look at the RCA, which is the what? The right coronary artery. The RCA, the right coronary artery. Now, the right coronary artery, I want you to write, it supplies the right atrium. It supplies the most of the right ventricle. It supplies the part of the left ventricle. It supplies the part of the interventricular septum. It supplies the SA node and the what? The AV node. And I'm going to give you 2 minutes to copy. I want you to write it down. Write down the places write the RCA supply. Write it down. All right. Now, remember the right atrium, most of the right ventricles, part of the left ventricle, part of the interventricular septum, the SA node, and the AV node. I believe every wonderful students have written this down. All right, before I explain. Now, this RCA, which is the right coronary artery, it has branches. This is where council questions can come from. The branches of the RCA. The branches of the RCA, which is what? Right marginal artery. I will explain and it will be simplified by the grace of God. Just listen and write. That's why I'm giving you time to write because you need notes. So we have the right marginal artery. We have the posterior interventricular artery. So the right marginal artery runs along the right margin of the heart and supplies mainly the right ventricle. All right? Marginal means along the edge or borders. Now we have the next one we have the LCA, the left coronary artery. The left coronary artery is usually short before dividing into two major branches. The left coronary artery is usually short before dividing into two major branches. Number one branch is the anterior interventricular artery, LAD, all right? Also called the left anterior descending artery, LAD, left anterior descending artery. Where does it supply? It supplies much of the left ventricles. It supplies the part of the right ventricle. It supplies, well, I'm reading this in so that you will write. It supplies anterior part of the interventricular septum. It supplies the apex of the heart. That is for the LAD. That is a branch of the left coronary artery. Are we together? Then we have the circumflex artery. The circumflex artery travels around the left side of the heart in the coronary sulcus. It supplies mainly the left atrium, the lateral and posterior part of the left ventricle. So from the word circumflex, it means to curve or to bend around. So the circumflex artery curves around the heart. So what happens after the heart muscles uses up the blood? The myocardium takes oxygen, glucose, and other nutrients from the coronary blood. It produces carbon dioxide and metabolic waste. The deoxygenated blood is collected by cardiac veins. These veins eventually drains into the coronary sinus. All right? The coronary sinus collects most of the venous blood from the heart muscles and empties it into the right atrium. This is very, very simple. So this is the flow. We have the aorta, that is the ascending aorta, branches into right or left coronary arteries, which gives rise to smaller coronary branches, which I explained, which now supply the heart muscles, the myocardium, and after supplying the heart muscles, it becomes the coronary sinus. It becomes the coronary sinus. After which it supply the what? The right. It supply the what? The right atrium. Please, are we together? Wonderful students, are we together? Notify me. Do you have question? Any questions so far? All right. Now, let us simplify. Now, firstly, let us start from the heart. I believe every student still remembers. Now, in case you are being given this for your viva, which is the heart, you should know that the blue side is the what? The veins. Why this red side is the what? The arteries. It is red because it carries oxygen. Why this blue side is blue? Because it is deoxygenated. I believe you're preparing for council, you should know this already. So we remember that this is called the what? superior vena cava. This is the superior vena cava. All right. This is the inferior vena cava. All right. This is the right atrium. This is the right atrium. This is the right ventricles divided by the what? In the tricuspid valve. This is the pulmonary trunk. I believe every student know this. This is the pulmonary trunk. This is the left atrium. This is the left atrium. This is the left ventricle. This is the left ventricle. And this is the aorta. And this is the pulmonary veins. This is the pulmonary veins. All right? Now, please pay rapt attention. This is the SA node that generates action potential. This is the AV node. Now, I'm not going in depth in this because I believe every student know these terminologies I am calling. Please, if you don't know it, please notify me, because what we are only discussing this night is the coronary circulation and supply to the muscles of the heart. So if you don't know what the SA node is, the AV node, the Purkinje fibers, the bundle of His, and please make sure you notify me. Are we together? So I come again in identification. What we are trying to discuss this night is that this this is the heart. This is the heart. There is something that supply the muscles of this heart. And what supply the muscles of this heart is called the coronary artery. The coronary artery is what supply the muscles of this heart. Are we together? This is the right side. And the right side houses what? The right atrium and the right ventricle. Please, you are in this life. In case you don't understand anything, please notify me in the comment section. Don't just keep quiet. Notify me. Very important. All right? Now, this is the right side of the heart. And we know that blood flows from the IVC and the SVC into the what? The right atrium. And from the right atrium, it enters through a three-mouth valve into the right ventricle. That will be a class of another time. Now, what I'm just trying to say is that this is the right side of the heart, where we have the right atrium and the right ventricle. This side is the right side of the heart. This side is the left side of the heart. This is a division. This septum. Whenever you have the word septum, 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 it means something that divides something. All right. Septum divides the right side from the left side. Now, let me bring a simplification. Now, just like your chest divides your right hand from your left hand, that is the same way your chest, that is the same way your chest is like, I'm giving a shortcut. Your chest is like a septum dividing your right hand from your left hand. In that same way, there is a septum here, a division here, dividing the right side of the heart and the left side of the heart. So what are we trying to say? We're trying to say that the heart has right side and it has left side. Do we understand up to this point? The heart has what? Right side and it has what? Left side. So what we are also trying to say is that there are arteries. Remember, arteries are the one that carries oxygen, while veins are the one that carries no oxygen. There is no oxygen inside veins, but arteries carries what? Oxygen. So we've also acknowledged and we've noted that the heart have right side and it has left side. What are the contents of the right side? We have the right atrium, we have the right ventricle. What are the contents of the left side? We have the left atrium, we have the left ventricle. So the arteries that supply the right side is totally different from the arteries that supply the left side. You must see this in your council exam. Please don't joke with this topic. It comes out a lot and it is not being taught in many colleges and universities. Please, that is why you need to listen carefully and comprehend by the grace of God. Are we together? So now, nurse brainy shortcut. Now, think of a family, all right? Think of a family that is living together, but they are divided by a wall. The people visiting the other house is not the same friends visiting the other side. If you notice, this side is kind of a blue in color, and this side is kind of red because this is where the oxygenated blood that is coming from the lungs enter. Why this is where the oxygenated blood enters. All right. So think of a house, which is the heart, divided by a wall, which is the septum. And the house A and house B, this flat A and flat B of the other side is visited by a different friend. They are visited by different friends and neighbors. While this side C and D is visited by different people also, because there is a demarcation, a septum dividing them. In that same way, we have coronary arteries. The coronary artery supplying the right side, this A and B, is totally different from the coronary artery supplying this left side. Please, do we understand where we are going now? Please notify me, wonderful students. If you are following me, if you're understanding me, notify me in the comment section. Please notify me. That is why we are having live session, so that students can ask questions, so it will be interactive. Are we together? So I'm impressed with the students that are comprehending. I'm impressed. So now look at every student that is a council student should already know the diagram of the heart. Every student that is you are already a council student, so you should know the diagram of the heart. So you should know that the right side have what we call the SA node and the AV node. The right side have what we call the SA node and the AV node. Now I know that there are some students that are not in the private lecture room that are joining this class. I am aware. This is just to help a lot of students so that they can pass. All right. Don't think that Nosbrain is not aware. I'm aware, but just to help a lot of students so that they will pass this exam. All right. So we have what we call the SA node and the AV node, and this SA node and the AV node is in the right side. All right. And this side, this left side, there is no node there. Please, if you don't know what SA node and AV node is, please notify me. To be a different lecture, but that will be in the Telegram group. Are we together? Now, we have the SA node and the AV node. From the word SA node, if you know this SA node and AV node, ECG will be so simple for you. All right? Now, I want okay, when we discuss on that, I would have want us to do a practical. This SA node is the node that generates 60 to 100 action potential. Are we together? So this SA node and the AV node is in this right side where we have precisely the right atrium. So that means the coronary artery that is supplying this right side will also supply the SA node and the AV node. Then the coronary artery that is supplying the left side will supply only the left side, because there is a septum dividing the right side from the left side. What is Nosbreni short called? Think of a compound divided with a wall. The people visiting this, the right people, the right neighbors is totally different from people living at the left side of that compound, because there is a wall called the septum dividing it. So the coronary artery is supplying right the right side of the heart is totally different from the coronary artery supplying the left side of the heart. Please, are we together? Yes, we are together. Now, that will quickly make us look at what we were discussing, because I believe many students are having a better glimpse of what we were actually discussing. Now, look at the right coronary artery. Now, many students, I'm impressed with the messages I'm getting. Many students have a better understanding of what I was reading before. And like I said, I was reading it so that you all students will what copy and write. But now, after the explanation, many students are notifying me that they have a better understanding of what I was saying initially. Now, look at the right coronary artery, the RCA. So the RCA supplies the right side of the heart. And remember, the right side have what? what we call the SA node. You don't cram in this class, you learn. In Brain Academy, by the grace of God, you don't cram, you do what you learn and have knowledge so that you pass your council exam. So we have the SA node. And from the structure of the heart, the SA node is in the right side of the heart, where we have the right atrium and the right ventricle. So the right coronary artery is the artery that supplies the right side of the heart, precisely the right muscles of the heart. So where does it supply? Number one, the right atrium, the right ventricle, a little bit of the left ventricle. Now, the interventricular septum, the wall, because a wall that is dividing a compound, the people at the right side can touch the wall. So part of the interventricular septum. Now, the SA node, it supplies the SA node, it supplies the AV node. Don't cram in this class. So the right coronary artery supplies the right atrium. Let's just make a precise conclusion of where can come out in your exam. You'll be asked the question: the right coronary artery, which is the RCA, supplies where? It supplies the what? The right atrium, the right ventricle, the SA node, and the AV node. You are very correct. Are we together? Yes. Is this simplified? Yes. Now, the RCA has branches, and this branch is called the marginal artery and the word posterior interventricular artery. I come again. The branch of the RCA is called the word the marginal artery and the posterior interventricular artery. Now, whenever you hear the word marginal, what did Nurse Brainy say about marginal? You will remember there's what we call in your books, there's what we call margin. They will tell you don't write in the margin. So margin means edge. So now let's go to the heart. Let's go to the heart. So this is the right side of the heart. So there are arteries, coronary arteries that supply the edges of this right side. What do we call that artery? Notify me in the comment section. What do we call the artery that supplies the edges of the right side of the heart? Now you are correct. It is called the marginal arteries. The marginal arteries. The marginal arteries. Now, this is the right atrium. And the right atrium, after the right atrium, it is being divided by a three-mouth valve, which is called the tricuspid valve. Then we have the right ventricle. Now, another name for the tricuspid valve is called interventricular valve. Inter means like international, between Nigeria and another country, and America, international. The word inter, where we have intra, means just within a country. So when we have inter, means between two different countries or between two different entities. Are we together? So the right coronary artery is branched into marginal arteries, the one that supply the edges of the heart, and the interventricular, the one that supply the atrium and the ventricles. That is for the right coronary artery, the RCA, divided into what? Interventricular artery and the marginal artery. Please don't forget this. Please don't forget this. Are we together? So the right marginal artery and the posterior, not the anterior, the posterior interventricular what? Artery. Now we have the left coronary artery, which is the what? The LCA. The left coronary artery, which is the what? The LCA. It is now divided into the what? Anterior interventricular artery. Anterior, remember that the right coronary artery is divided into what? Posterior interventricular artery. Inter means in between the ventricles. All right. So the left coronary artery supplies the anterior interventricular artery, otherwise known as the what? I'm impressed with this student. Roselyn, I'm impressed. The Otherwise, the anterior interventricular artery, that is the LAD, is also called the left anterior descending artery. It is starting from the aorta. Remember, all this starts from the aorta and it begins to descend down. So it is called the left anterior descending artery, also known as what? Anterior interventricular what? Artery. So where does it supply? It supply much of the left ventricle, it supply part of the right ventricle, it supply the anterior part of the interventricular septum, and it supply the apex of the heart. This class is so simple. Are we together? Now, another branch of the left side of the heart is the what? Circumflex artery. Circumflex artery. The circumflex artery travels around the left side of the heart in a coronary sulcus. It supplies mainly the left atrium and the lateral and the posterior part of the left atrium. So what are we just trying to say? This topic is so difficult, but by God's grace, it is being simplified in this Nurse Brainy Academy. Now, making it in a simplified way, this is the right side of the heart. The right side, we have the right atrium and the right ventricle. In between is interventricular, all right? And we say that the right side and the right side of the heart has branches, which is the word the marginal artery, the one that goes round the margin, the marginal artery, and the posterior interventricular what? Artery. It supplies the back. So the right side supplies the what? The back of the interventricular arteries or muscles. Are we together? Now, the left side houses what we call the what? The left side houses what we call the what? The circumflex artery. Circumflex, it goes in a curved manner. It goes in a circular manner. Please, this comes out in exam. Please note this place. You will see questions like the left side of the heart branches into what and what. The right ascending circumflex artery, descending this, descending that. Don't forget that the left side is anterior. The left side goes anteriorly, while the right side goes posteriorly. So the right side of the heart is divided into two, which is the what? The LAD and the circumflex artery. Circumflex, it goes in a circular way. While the right side is divided into marginal, it goes along the edges. Marginal artery. This is a very difficult topic. It goes in a what? In a marginal manner. It goes along the edges and the posterior interventricular what? Areas. While the left side goes in the circumflex, it goes in a circumflex manner. It goes round the left side. It goes in a circumflex way, and and also another branch is the what? The anterior interventricular what? Artery. Please, are we together? Do we understand what we are trying to say? And this is it here. The right side of the heart, remember that the coronary artery branches from the what? Ascending aorta. This is the aorta. All right, just before the arc of above the arc of the aorta. This is the what? Branches, where we have the right side of the heart and the left side of the heart. The right side of the heart and the what? The left side of the heart. And we say that the right side, which is supply the what? The right atrium and the left atrium, while the left side supplies the left side of the heart, which is the left atrium and the left ventricle. And we said that the right side goes in a marginal way. Look at it, it's going along the edges. It goes in a marginal way. And from that marginal way, if you can see, this one goes at the back. So it goes in a marginal way and supply the posterior back interventricular areas of this right side. It supplies the SA node and the AV node because the SA node and the AV node is in the right atrium. So the right coronary artery, which is the RCA, supply anything right side and is divided into two branch, which is the what? What are the branches? The branches are the what? Marginal artery. Marginal. It goes in a marginal way. And the what? Posterior interventricular what? Artery. Marginal artery. And the what? Posterior interventricular what? Artery. These are the branches of the right coronary artery. Interventricular, it is supplying the posterior right atrium and posterior right ventricle. Interventricular, between the right atrium and the left ventricle, interventricular. Are we together? Then the other part, which is the what? The other part, which is the what? The left side of the heart is being supplied by the what? The what? What supplies the left side of the heart? Let me know those students that are following. The correct answer is the word the coronary artery because it goes in a circular way. The coronary artery and what descending what artery, which is the lad, which goes in the front. If you look at this, it goes in the front. Why the other went at the side and at the back? Why this side goes in front? It goes in front and what? In a circular way, which is the what? The left side is the what? Circumference artery. And the anterior interventricular what? Artery. These are the branches of the what? The left side. Now, this is a Nosbrani shortcut. And I want every wonderful student to raise their left hand. Please notify me if you did this. I want you to do it. Keep your phone by the side and do this practice I want you to do, because in this academy, by the grace of God, you don't cram, you learn. You learn and have perfect knowledge so that in your exam, you will remember this Nosbrani shortcut and never forget it. The first Nosbrani shortcut I gave is that think of a building or a family that is being separated by a wall, and that wall is the septum. So that because it's separated by the wall, we have the right side in that compound and we have the left side. And we said that the visitors that comes every time periodically to visit the people living in the left side is different from the friends coming to visit the people in the right side. In that way, we said that the arteries that supply blood to the myocardium of the right side is different from the arteries that supply blood to the myocardium of the left side. Having noted this shortcut, I believe every student understands it. And the word that separates them is called the word the septum. So the two friends that comes to visit the people at the left, let's start from the right. The two friends that come to visit the people at the right that comes to visit the right atrium and the right ventricle. The two friends that come is the what? The marginal artery. This marginal artery is this marginal artery is a friend that like to stay at the edge. He does not like to come inside very well. He stays at the edge of the door. So the marginal artery stays at the edge. It goes around the edge. And also the posterior, there is always that friend that always sit at the back. The posterior what? Interventricular what? Artery. These are the branch of the what? The right side of the heart. And we said that they had been divided by a wall known as the septum. We have another two friends that visit the left side, which is the what? The circumference artery and the what? The lad. The circumference artery and the what? The lad. And we said that this lad is otherwise known as what? Anterior interventricular what? Artery. Anterior interventricular artery and the circumference artery. Now, having noted that we have a shortcut in front of us, and I said every wonderful student should do this. You know, this topic is very vast, but it is being simplified in few minutes by the grace of God. So that is why you need to listen carefully. Are we together? I'm impressed with the reviews I'm getting from my wonderful students. You all are wonderful, and I love you all so much. I'm impressed with you all. Now, I want every student, please notify me if you did this. I want every student to raise their left hand and use their right hand and place it at the back. I want you to do this. Place your left hand, your right hand at the back and raise your left hand. Please, your left hand should be raised. Just do it. Just do what I'm asking you to do because of exam sake. Because council, there will be tension in the hall. So you don't need to, you don't pass with past questions because the tension will not allow you to remember what you cram. That is why you need knowledge. You need to know. You see this, you know, yes, this supplies this supply that. Are we together? So having your hand already placed in that position, number one thing is that Nurse Brain is impressed with you for doing what I asked you to do. All right. Now, this, if you notice that you placed your one, you as a wonderful, you placed your right hand at the back. Now, what are we trying to say? The right side of the right coronary artery goes posteriorly, posterior interventricular, posterior at the back, the right hand. You that is listening to me now, your right hand went to your back. So don't forget it. All right, in exam hall, in case you see this, the posterior part of the heart of the coronary artery, the coronary artery branches into what? Margina. It goes, your hand went from the edge of your body and went to the back. So it houses what? The what? The marginal artery. It branches the right coronary artery. That's the RCA, branches into the what? Marginal artery and the posterior interventricular what? Artery. I'm impressed with this shortcut. While your left hand, which is raised, if you notice, the palm is facing front. The left hand branches into what we call the what? The anterior. It goes to the front. Anterior and the circumference. It goes in a circular way, curve. The artery is curved. So the left coronary artery branches into what? Circumference artery and what? Anterior interventricular what? Artery. Please, is this simplified? You don't cram in this class. You don't cram in this class. Please, you don't cram. That is why I say do this thing I'm asking you to do. Your right hand at the back, the right coronary artery supply posterior interventricular what? Artery and what? Marginal artery. While the left side, it branches into what? Coronary artery and the anterior descending artery. Anterior. While the right side is posterior. It goes what? Posteriorly. Are we together? Is this being simplified? Never forget that the right side houses what we call the SA node and the AV node. Don't forget this. The right side houses what we call the SA node and the AV node. The SA node and the AV node. So the right artery supplies the right coronary artery supply even the SA node and the AV node, the right atrium, the right ventricle. While the left coronary artery supplies the left coronary artery, the left atrium, and the left ventricle. Are we together? Are we together? Are we together? Don't forget this shortcut. Don't forget this shortcut. In case of your exam, you are being asked the right coronary artery, the RCA, it comes in this way. You might not see the right coronary artery. Whenever you see the RCA branches into what and what, you remember right hand at the back, your right hand at the back. Noseboni shortcut, Noseboni said, place your right hand at the back. So the right coronary artery supplies the posterior interventricular. It branches into the posterior interventricular artery and the marginal at the edge of your body, at the edge, marginal artery and the posterior interventricular artery. So Nosbreni said to remember this, Nosbreni gave a shortcut of a man that placed his hands at the back and the left hand in front, the left hand in front, and that left hand symbolizes the word coronary artery. Coronary artery, it goes in a circular way. It goes in a circular way and it supplies anterior interventricular, it branches anterior interventricular what? Artery. It branches as the anterior interventricular artery, anterior front. While the right side, Nosbrin said the right hand at the back, the right side is what? The marginal and the what? The marginal and the what? Posterior interventricular what? Artery. So after the muscles of the heart receive blood, it is being drained by great veins of the heart. Don't forget this. The veins that drains the heart are the great veins of the heart, the middle veins, all of them, all the veins of this, all these small veins, drain them into what we call the coronary sinus. All of them are called the cardiac veins. They drain them into the what? Coronary sinuses. This is an exam question. Please note this. Coronary sinus is like a basket that contains all the veins, all the blood that is being used up by the heart muscles. Remember, coronary arteries are arteries that carries oxygenated blood and it supply the heart muscles. After the heart muscles have used up the blood, it enters the great veins, the middle veins, and other smaller veins, and it all branches into one vein, which is the word coronary sinus. The coronary sinus. So, for in a nutshell, the coronary sinus is the vein that drains the heart muscles, while the coronary arteries is the artery that supply the heart muscles. While the coronary vein is the vein is why the coronary veins are veins that what that drains the already used blood into the coronary sinus, and the coronary sinus pours all of them into the what right atrium. That branch us to what we call the blood flow through the heart, which will be on another discussion. So that is why we say when you are being asked what is the blood flow through the heart, you will say that blood flow through the heart can be simplified in this manner, that the IVC and the SVC and the coronary sinus drains used up blood into the what? Right atrium. Please, I'm impressed many students are following. So there are three veins that drains into the right atrium that pours all they have drained from the body. The IVC, which is the inferior vena cava, is draining all the used up blood from the lower part of the body, while the SVC is draining all the used up blood from the upper part of the body. Then this heart needs to be drained. The coronary sinus is draining the used up blood from the heart muscles. All of them, the IVC, the SVC, they are draining, and the coronary sinus, they are pouring every used up blood into what? The what? Right atrium. And from the right atrium, it passes into a three-mouth valve, the tricuspid valve, into the right ventricle. By the pumping action of the Purkinje fibers, it enters into the what? Pulmonary trunk. From pulmonary trunk, it enters into the heart, into the lungs for oxygenation. So the blood flow and others will be, in case if there are students, I know there are many students that already know the blood flow through the heart, but if there are some that don't know, please notify me. It will be simplified in another class. But I want you all to notify me. Hope you learned something in this class about the coronary what? Hope you learned something in this class about the what? The coronary circulation. Hope you learned something about this coronary circulation. It can be tactical, but when you remember the nose brainy shortcut, you will not forget it. The first thing that nose brainy said, I'm impressed with this student. I'm impressed with this student that now please, that student that said right answer, please notify me in the on WhatsApp. I want to know you. I want to, because I'm impressed with every student that is following. I'm impressed with all of you. I'm impressed. Now, don't forget that this coronary arteries comes from the word. This coronary arteries come from the word ascending aorta. The ascending aorta. Remember, this is the aorta. This is the aorta. So the coronary arteries branch from the word ascending aorta, not the descending aorta. These are council. This is a, you must see this in your council exam. Please don't neglect it. It is being barely taught in colleges and universities. That is why I said I will bring out my time and simplify this. And I believe by God's grace, this lecture is simplified. The coronary circulation. The word coronary means is coronary artery is what supplying the heart. Coronary sinus is draining the heart. Again, coronary artery supplying the heart. Coronary sinus draining the heart. I come again. Coronary artery supplying the heart. Coronary sinus draining the heart. And Nosbreni gave a shortcut of a compound that is being divided by a wall. Nosbreni shortcut. So whenever you hear of coronary circulation, what should come to your mind? A compound that is being divided by a wall, where there are people living at the right side of that compound and people living at the left side of that compound. And that wall, Nosbreni called it a septum. And Nosbreni said that the people living at the right side, they are being visited by some group of friends. And those group of friends is not visiting the people at the left side. The people at the left side is being visited by another group of friends. And those people that are visiting the left side is not visiting the right side because there is a wall, there is a demarcation there, known as the interventricular word septum. Are we together? So the people visiting the people living at the side is known as the RCA, the right coronary arteries. Are visiting the word the I'm impressed with this student. Please notify me on WhatsApp. I need to know you. All right. I need to know you that he has been following the class. God bless you too. God bless you too and strengthen you too. I'm impressed with your wonderful comments that you understood the class. So the people living at the right side, please send me your reviews. Like I always say, your reviews means a lot to the academy because it helps me know the NBA class that is following more so that I can channel my strength. The academy can channel their strength in helping students of that MBA class. For those that are not in the private lecture room, please do well to join the private lecture room. It's in the private lecture room, and if you know you've not subscribed, make sure you subscribe so that when I go live like this, because I did not notify a lot of you that I have gone live. So when we go live like this, you'll be notified immediately. All right, maybe probably when you are in class, because very soon we'll start 250 questions to help students pass. We'll start answering 250 questions. Study with Nosbreni. That is, if we are studying, we are explaining, right? So make sure you have subscribed so that you get notified. Now, your reviews means a whole lot. Make sure you always send your reviews so that this helps me know the students that are following. Your reviews means a whole lot, and the MBA class that is following. If you've not joined a private lecture room, we are aware that some students have not joined, and we are aware. But make sure to do what to join. That is where you will get lectures from other courses, such as entrepreneurship, quality improvement, and others, pharmacology and others. That's where you will get lectures on that, simplified lecture on that. So please, if you know you join this live session, don't neglect coronary circulation. You will see question from it in your council exam. It is being asked in council exam. And how does the question come? Which one branches to which one? Remember the Nosbreni shortcut. And Nosbreni said every wonderful student should place their hand at the what? At the what? The right hand at the back And we said that the RCA, which is the people that visit the people living at the right side of the compound, I'm using Osborne shortcut, people that visit those, the RCAs are people that visit the right atrium and the left. Okay. You said you would chat me up. Okay, chat me up, no problem. I'm impressed. So the RCA are the people that visit the right side of the heart. From the word RCA, R means right coronary artery. Then the LCA, L means left coronary artery. Visit the left side of people living in the compound of the left side of the compound using Osborne shortcut. And we said that the RCA is branched into two, and Osborne gave the most simplified shortcut. All right, the most simplified shortcut you can find on the internet. This is the most simplified one by the grace of God. That is why I said you can't do anything without God. So make sure you always trust God. All right. So the right, the RCA was going to say place your right hand at the back. All right. So the RCA is branched into marginal artery and the what? Posterior. Why placing at the back? Posterior interventricular artery. Why the left synovial instead is divided into, is branched into the what? The circumflex artery and the what? Anterior interventricular descending artery. Hope this class is simplified. So if you know you learned something, you see the time. These are sacrifices to make sure you pass your exam. This is almost to 12, and these are sacrifices to make sure you pass your exam. So send me your reviews. God bless you. God bless you. God bless you. Send me your wonderful reviews. Because Brainy loves you all. God bless you.